welcome to Module 10. This week talks about the termination and evaluation process, and some might see this as the most difficult part of the family group cycle for many reasons. One, you might just have mixed feelings about your time with a group coming to an end. Sometimes you're sad to see your clients go, or you might feel like, especially when you feel like you truly made a difference or you bonded and had a great rapport with the family. Or you might feel anxious and concerned that they won't be successful and that you wish you could have done more or something different. And of course, we've all been in a situation or will be in a situation that we're very ready for our therapeutic relationship to come to an end, especially if it's been strenuous or difficult. Regardless, it's important to end these sessions in an effective and ethical manner. So while we hope that our terminations end because it's the end of the program or the services we outlined in the treatment plan, unfortunately, there are going to be other reasons that these services might end or there might be premature termination. It's important that we're being mindful of those causes as well, as it can hopefully help provide us some insight to help our future clients. We may see that clients are unable to make appointments, whether this be barriers of money or transportation, insurance even, or that maybe not all members of the group are bought into the services, so aren't attending. As social workers, we should be aware of these factors for our clients and do what we can, whether it's concrete resource provision, such as providing a taxi cab ride if we're able to, helping link them with the local job and family services to obtain some type of insurance, or even just doing motivational interviewing with the member of the group or family that isn't buying into the services. Or even just being transparent about our services and expectations that we have for our clients. All of those things might help us prevent premature termination. So being mindful and being cognizant of those reasons is really important. When we face more ethical concerns for premature termination, we might be seeing concerns about dual relationships forming or feeling that we're simply not equipped enough to manage the needs of our clients, which can be a difficult pill to swallow as we're all professional practitioners, but important nonetheless. In a previous example of a family group we've talked about during this course, we talked about working with a family that ultimately wants to reduce family conflict, but one member has suicidal ideation. And as a practitioner, if you're someone that cannot manage the crisis and don't have the skill set yet to manage crisis of either acute or chronic suicidal ideation, it would be really vital that we recognize this to ensure that the client with suicidal ideation is receiving the services that they need, especially in times of crisis. In times that clients don't complete the program or the process, it's important that in times that clients do complete the program or the process, it's important that we're having a final visit for termination rather than just not rescheduling and saying you're calling it a day because last session went really well. This creates closure for the clients, incorporates time for evaluation, and allows us to determine whether they need additional resources or referrals at the end of our services. While this could be built into the treatment plan that you're using or the plan or the map of goals that you're using to work with the clients, it could be at a different time too than expected at the time for termination. So just be mindful that you might have to be flexible to change with this talk of termination. We'll talk about evaluations in just a second more in depth, but allowing time for evaluations to be completed in this termination session often ensures that we get the responses we're desiring. There are many times, I'm sure all of us receive surveys in our emails or in our mail even. Maybe it's after we bought a car, maybe it's after receiving a service, and we simply just don't complete the surveys for time, maybe due to forgetfulness, or we press the end button on the call rather than taking that survey. And so that happens so often in our daily lives, we'd be naive to think that it doesn't happen after social work services as well. So please make sure that you are reading the NASW article about termination, as it's something you're definitely going to be referencing throughout your career, whether you're an individual, group, or other types of practice. For the evaluations, this is one of the most important parts of our work to see if what interventions were implemented were effective, but even if the whole process from start to finish was effective, helpful, or if there are things we can do to change. We often can only gauge so much success off of what we see and what we hear, but using an evaluation tool, whatever it might be, is really vital for us to be able to improve our own practice by learning. Evaluations are definitely a stressful time for many. As you know, I sent out information about completing an evaluation for this course. And even for something like a class, I always get mixed feelings about receiving these evaluations. There's a part of you that might feel eager to see how your time went, but also interested in hearing what you can do differently to benefit the masses. And the same goes when we're working with clients. In the article that was in the module about evaluation of an in-home family therapy for families at risk of foster care placement, one of the most interesting things, if you read that article yet, or if you're going to be reading, is that it talks about a lack of evidence to support outcomes for at-risk families, but the data from that specific article is from 2007. So I do want you to know that many programs have shown to increase outcomes for families since that time, and a lot of these programs are effective, and that's because there's consistent evaluation going on for programs. And so to step outside of the social work box a little bit, I wanted to share about a program that many might find interesting, a program called Nurse Family Partnership. And while it's not necessarily a therapeutic group, I think it does a good job demonstrating effectiveness of an outside-of-the-box kind of group setting. And it's pertinent to social workers because a lot of us might refer our families that we work with to this or another similar program. So the program essentially, if you haven't heard of it, is for first-time moms, and they receive support from home visiting nurses during their pregnancy and receive regular visits from nurses during the infant's birth, as well as up until their second birthday. So while it's not necessarily serving a family, a lot of the nurses I know employed in this program do describe this as more of a group family dynamic at times, and explain that it's truly more than just education that they're giving to these families and moms and their babies. They're really consistently assessing the social and health needs of the child and those around them. And so this program has been researched for the last 40 years. At times it was called different things, and there are many programs that are similar to this, but it's shown to be successful in order to better assist the lives of moms and babies, many of which are able to eventually prevent foster care placement. And so when they did many evaluations over the past 4 decades, some of the data that was collected from these evaluations shows that every dollar invested in the program saves almost $6 in future government-related costs for high-risk families. And it also showed that there was a 48% reduction in child abuse and neglect for families involved with this program. There are many additional results, and I'll put a link in the announcement with this program, but these results were determined through quasi-experimental design studies as long as direct feedback. And we can talk about these different types of tools all day. I know you're learning about them in other courses as well, but I wanted to explain how the evaluation of this program is so important. While we see in one article that maybe there's not enough research out there to tell us that some of these programs are effective, if we really look into certain programs and we see the studies they've done over time, we might have a different perspective, and that's all told to us through these evaluations that are completed and the data that's gathered. Evaluations, again, are so important because we use them not only on larger scale programs like a national program such as Nurse Family Partnership, but even on smaller scale cases if it's with an individual or a family as well. This can include even things like not collecting major points of data, but just asking basic interview questions. This can be something like, were there any barriers that made you think it would be difficult to complete this program? Is there any advice that you would give me moving forward in working with families or individuals? We need to be aware of our evaluation results, not only for our own clients, but for other programs in order to know if we're doing a good job, but also if we're referring them to something that is reputable and helpful. Ensuring the use of evidence-based practice is part of our ethical duties as social workers, so being mindful of that really is in our code of ethics. If you have any questions, feel free to reach out to me. There are a lot of interesting videos on YouTube. I won't post all the links here, but you can search in YouTube termination. And there's some interesting videos that you might see that are even from an individual perspective about how they might have a conversation with their therapist to end a therapeutic relationship. And so really watching some of those videos to see it from the other hand or from the other side is really helpful and interesting. So again, if you have any questions, please feel free to reach out, and you can look at some of the links I post about home visiting programs.